Okay, so now today we are going to discuss few MCQs. So the first question for the oral surgery PYQs is: it is a commonly encountered complication during the extraction of maxillary third molar. Options are oroanal communication, root displacement into the sinus, excessive hemorrhage, or fracture of the maxillary tuberosity. So now over here, the answer is maxillary tuberosity fracture. So this is the most common complication during the extraction of the maxillary third molar. What happens is the anatomic position at the end of the dentoalveolar arch is such that the position or this portion has no support, and the internal composition maybe like it can be significantly a maxillary sinus or a soft osteoporotic bone. So it has been seen that incidence of the maxillary tuberosity fracture is 0.6%. Extraction of 500 maxillary third molar is accompanied by 3 fractures of maxillary tuberosity. Secondly, what can occur is displacement of third molar. Displacement of third molar into the maxillary sinus can occur due to the excessive apical force or incorrect surgical technique. And thirdly, there can be oroanal communication or fistula. It occurs usually during the extraction of the first molar followed by the second molar. So this is more common during the extraction of first molar followed by second molar. Okay. Now come to the next question. The use of the medical history in extraction patient is, the options are required in medical legal cases, to assess the growth stage of a patient, to determine the bleeding disorder, or to determine the communicable diseases. So the medical history is used to determine the bleeding disorders in the patients who are undergoing dental extraction. The most appropriate option here was the bleeding disorders. Family history. What does the family history do? A complete and careful family history is important because many coagulation disorders are inherited. Medications and supplements, why do we ask them? Because they might be on anticoagulant therapy. And we also ask the bleeding history because previous unusual bleeding episodes, such as spontaneous bleeding or easy or frequent bruising or bleeding after surgery or injury, may also indicate that we might have the risk of bleeding in future. Next question. In Warface assessment of impacted third molar, A stands for. So, what is this Warface scoring system? Let's write what W stands for. It is Venter's classification. Then H stands for height of mandible. A, the question which has asked, A is the angulation of third molar. R is the root shape. F is the follicle path of exit of tooth. Tooth during removal. Okay, so this is Warface assessment. W is the Winters classification, H is the height of the mandible, A is the angulation of the third molar, R is the root shape, and F is the follicular path of the exit of the tooth during removal. So when the inferior alveolar nerve canal, this is an important point which you can remember, additional point which I'm giving you for our glass appearance. Hourglass appearance. Okay. So when the inferior alveolar canal crosses the root apex, there is reduction in its diameter. This narrowing and converging appearance of the canal is due to the displacement of the roof and the floor of the canal towards each other, resulting in hourglass appearance. This appearance indicates partial encirclement of the canal. Now we come to the next question. The displacement of the root into the maxillary sinus during the extraction is most likely to happen during the extraction of the maxillary canine, deciduous first molar, or second molar, which we have discussed in the previous question only. So this displacement occurs most commonly during the extraction of the first molar. Okay, so it occurs mostly during the extraction of the first molar. Usually the palatal root of the maxillary first molar is present closer to the maxillary sinus, followed by the second premolar, first premolar, and lastly the maxillary second molar. This is the what I am telling you is the palatal root distance from the maxillary third molar. Okay, and the displacement chances are for maxillary first molar first, and then the second molar. But the root which is nearer to the maxillary sinus is first for the maxillary first molar, then second premolar, then first premolar, and then second molar. Okay. So displacement of the tooth root into the maxillary sinus is most likely to happen during the extraction of maxillary first molar or the upper wisdom tooth. This is because the roots of the teeth are often close to the floor of the sinus, and the palatal root of the maxillary first molar is the most likely to get displaced. Now we come to the next question. One day after the complete mouth extraction, blue-black spots are seen on the neck of the patient. These spots indicate option A, thrombocytopenic purpura, option B, postoperative ecchymosis, option C, impaired blood circulation complication, or option D, cellulitis. So here the answer is post-operative ecchymosis. What is this ecchymosis? These are the large extravasations of blood into subcutaneous tissue with facial discoloration caused by breakdown of the hemoglobin. And the common areas are circumorbital, submandibular regions, lower lip, and the floor of the mouth. Management. How do I manage it? Immediate application of cold followed by heat. In severe cases, antibiotics are given along with proteolytic enzymes which break down the coagulated blood. Now we come to the next question. A 23 years old female patient complains of decreased mouth opening since 4 days. This could be due to options are impacted third molar, oral submucous fibrosis, oropharyngeal fibrosis, and bone ankylosis of TMJ. The correct answer is first option, impacted tooth. Why not other options? Because अगर OSMF होता या bone ankylosis होता, it would not have been since just 4 days. These 4 days is an indicator, okay, for the answer. So pericoronitis associated with impacted tooth results in muscle trismus, which leads to reduced mouth opening. Okay, let's come to the next question. An absolute contraindication for the extraction of the teeth. Options are hypertension, MI, thyroid toxicosis, and central hemangioma. So, what could be the answer? The answer is central hemangioma because it will lead to profuse bleeding and death if extraction is done in such a patient. Let's come to the next question. The lingual flap in the mandibular third molar is retracted by the options are Austen retractor, Howard retractor, bird spatula, or it does not matter. So, the we can be confused between the Howard retractor or bird spatula, but we will choose the answer broad spatula. Now, this Austen retractor, option 1, Austen retractor is used for reflecting the mucoperiosteal flap on the buccal side. Okay, not the lingual side, so the buccal side for raising the or retracting the flap on the buccal side so that the bone can be visualized and the mesiobuccal bone guttering can be done around the third molar. Next option, the Howard's retractor can be used for retracting the lingual flap because of the close proximity to the lingual nerve in relation to the impacted third molar. Greenwood et al. Showed that a broad lingual retractor, as compared to the Howard's retractor, was much less likely to be associated with a sensory loss. So, it was told by Greenwood et al. That broad spatula or sorry, broad lingual retractor will be more suitable to prevent the sensory loss. Next question is ideal time for the removal of maxillary or impacted third molar. So the ideal time is when the root roots of the teeth are 2/3 formed. And the ideal time is when the roots are 1/3 to 2/3 formed, which generally corresponds to the middle to the teenage years. If it is removed too early, no root is formed. The extraction process is difficult because the tooth tends to roll around in the bony crypt. And if the roots are completely formed, the tooth is anchored firmly into the place. Next question. Number 16 Cajon forceps are specially designed to extract. The options are maxillary, first and second premolars, mandibular central incisors, mandibular molars, or maxillary molars. So the correct answer over here is, because it is number 16, it is used to remove the mandibular third molars. So the cow horn forceps are usually used for the removal of grossly decayed maxillary molars and more commonly mandibular third molars. Number 16 and 23 are used for the removal of mandibular third molars, and number 88 are used for maxillary third molars. So remember 16 and 23 for the mandibular third molar, number 88 for the maxillary third molars. Okay, we'll come to the next question. The most common tooth to get impacted, excluding the third molar, is options are maxillary canine, mandibular canine, maxillary second premolar, or mandibular second premolar. So the answer is the most common tooth to get impacted during the third molars, excluding the third molars, is the maxillary canine. So write few key points about the impacted teeth. What are impacted teeth? A tooth that fails to fully erupt through the gum line into its proper position. Most common impacted tooth is third molar. Most common impacted tooth except third molar or excluding third molar is maxillary canine. Okay. We come to the next question. The radiographic appearance of the inferior dental canal and the roots of the mandibular third molar is radiolucent band evident in relation to root of third molar, which is grooved, tunneled. Next question. The pain of the dry socket is experienced on first day after extraction, second day after extraction, third day after extraction, or after 7 days. So the correct option here is remember, always remember it is on the third day of extraction. Why? Why third day? Because the blood clot that protects the extraction site can dislodge or dissolve around this time and exposes the sensitive bone and nerves, which causes severe pain. Next question. A gauge screen in the oral cavity during the extraction of the primary teeth will hide the extraction forceps, help in clotting after extraction, calm the patient during extraction, or help prevent the aspiration of the tooth. So the answer is option 4, prevent aspiration of tooth. Next, the complication of using air rotor at 30,000 rpm for the impacted molar is options are necrosis of the bone, tissue laceration, tissue necrosis, or emphysema. So, what is the answer here? It is the emphysema. Okay, so it is the subcutaneous emphysema, where air is forced into the surrounding soft tissues during the surgery, causing swelling and a crackling sensation upon the palpation due to the air trapped under the skin, and this potentially can spread to the more serious areas like the neck or the chest if not managed properly. How does it happen? The mechanism: the high pressure air from the aerator can leak into the soft tissues through the surgical incisions or around the tooth, especially when working on a deeply impacted molar. So, it is never advised to use aerator for the surgical extraction of the impacted third molars. Use a micromotor. Which of the following elevators fits well in the operator's hand and can be rotated between the thumb and the finger? The options are Coupland elevator, the hospital pattern elevator, Winter's elevator, or Warwick James elevator. So the answer over here is Warwick James elevator. Next question. Which of the following is the most difficult impaction of a third molar? Mesioangular, vertical, partially impacted, or distriangular impaction. So, the most difficult of all is distoangular. Why? Position, which makes the axis difficult. Rotation. The extraction, during the extraction, the tooth tends to rotate posteriorly, due to its arc of rotation. The space There may be very less space in this triangular impaction because the tooth will be placed like this. Very less space will be there for the application of the elevator. It may try to rotate back to the this triangular position. Okay, and more chances of developing complications are also there in case of this triangular impaction. Let's come to the next question. The antibiotic cover is mandatory before extraction in the following condition of the heart: ischemic heart disease, hypertension, congestive cardiac failure, or congenital heart disease. So the answer here is congenital heart disease. Okay, let's write few important points, which is the high risk category where the prophylaxis is recommended. When there is prosthetic cardiac valve, bacterial endocarditis, cyanotic congenital heart disease, surgically constructed systemic pulmonary heart. Moderate risk category involves other congenital malformations, acquired valvular dysfunction, hypertrophic cardiomyocardium, mitral valve prolapse with regurgitation. Prophylaxis is not recommended. And negligible risk category is atrial defects, patent ductus arteriosus, coronary bypass graft, mitral valve prolapse without regurgitation, physiological, functional, or innocent heart murmur, and the previous rheumatic fever with valvular dysfunction. Now, next question. Dentist planning to remove an impacted tooth need which of the following radiographs? A periapical film, a bite-wing film with little or will be little of no use, or a lateral view will be required, or an anterior posterior view will be required. Here the options are not relevant to the impacted tooth. So the correct option here is that bite-wing film will be of little or no use because we want to extract the impacted tooth. So we usually need a OPG, panoramic X-ray, or panorix, which gives a complete picture of the jaw and the teeth, including the alignment of the teeth with the sinus, nerve canals, and it can be used to plan the treatment of the impacted wisdom teeth, and the jaw problems, and the dental implants. Periapical X-ray. Why not periapical X-ray? Because it will target a specific tooth, showing the entire tooth from the crown to the root as well as the supporting bone, but very less information about the nerve canals or sinuses. So it can be helpful, but most helpful would be panoramic X-ray. These days, CBCTs are also there, which give a 3D image Now the next question. During the extraction of the lower impacted right molar, bone is removed up to the furcation area, up to half of the roots, or up to the CEJ. So it is removed up to the CEJ. So what is used? A micromotor handpiece and burr is used with continuous irrigation as a coolant to reduce the necrosis of the bone. And chisel and mallet technique was used earlier because it caused less bone necrosis, but the chances of fracture of the bone were more and was less acceptable to the patient. Let's come to the next question. The working end of the crier is placed at the junction of the interseptal bone and the mesiobuccal portion of the root or over the interradicular bone. So, here write the sharp edge of the crier elevator or the east-west elevator. To remove the root of the multi-rooted tooth following the extraction of an adjacent one is valuable, and the sharp edge is introduced into the depth of the socket and engage the interradicular bone and the remaining root. Rotational movement is used. Okay, we come to the next question. The commonest complication after removal of the mandibular third molar is lingual nerve damage or dry socket. So the answer here is most common will be dry socket. Other complications are also there: pain, swelling, trismus, okay, reduced mouth opening. Next question. During an attempted extraction of the upper posterior teeth to determine the position of the roots displaced into the antrum, ideal radiograph would be bite-wing radiograph, IOPA, or upper oblique occlusal radiograph. So, as we are going to see the position of the displaced roots into the antrum, so we will require upper oblique occlusal radiograph. Next question. The mechanical advantage obtained from the wheel and axle principle is. So, answer here is 4.6. Let's write for various elevators. Here write elevator. Here write the mechanical advantage obtained. So for the crossbar or Winter's elevator, the mechanical advantage obtained is 4.6. This works on the wheel and axle principle. Okay. Next, the apex elevator, wedge elevator, extraction, forceps. For all of these, the mechanical advantage obtained is 2.5. Apex elevator, wedge elevator, and extraction forceps. And The straight elevator, the most common elevator used in exodontia. The straight elevators, the mechanical advantage obtained is 3. Okay, remember these. Then we come to the next question. So the most posterior teeth are removed least, maximum, last, or first. So they are removed first. Next question. The post-extraction bleeding in a leukemic patient is due to increase in the leukocytes, low calcium level, deficiency of clotting factors, or platelet disorder. So the answer here is the platelet disorder. There is actually thrombocytopenia, okay, which causes the spontaneous bleeding and PDK, ecchymosis, epistaxis, and melena, and it may be necessary to perform surgery on the patients with platelet counts in the range of 25,000 because difficulty in achieving platelet levels due to circulating platelet antibodies in such patients. And the best time of extraction in the pregnancy is first trimester, second trimester, third trimester, or none of these. So the answer here is the second trimester. Why not first? Why not first or third trimester? Because in the first trimester there is organogenesis occurring of the fetus. So there can be developmental malformation if there is stress and strain to the mother. And third trimester, large quantity of steroids in the blood, if they are there, the pituitary gland secretes oxytocin, which stimulates the uterine contraction, and chances of premature labor are there. Now we will find out the difficulties score. Here the angulation is given, the class 1, class 2, class 3, and level 1, level 2, level 3. Information is given. Options are 5, 7, 10, or 6. So let's see how this information was given to find the difficulty index. We'll see. See, Pell and Gregory gave a classification in my previous lectures. You can see class 1 is sufficient space is available between the anterior border of the ascending ramus and the distal side of the second molar. Class 2 is space is lesser than the mean distal width. That is, the distal portion of the third molar is covered by the bone from the ascending ramus, and class 3 is the third molar is totally embedded into the ramus. Position A, B, and C. A is the highest position of the tooth lies at the level of the occlusal line or above it, which the second molar. Then position B is highest position of the tooth is below the occlusal line but above the CEJ. And the third one is it lies below the CEJ. Okay. So we will see the difficulty index based on these 3 points. Firstly, remember based on the angulation, easiest is mesioangular. So mesioangular is given difficulty index 1. Horizontal or transverse is given 2, vertical is 3, and this triangular is 4. Okay, based on the depth, level A 1, B 2, and C is 3, and Ramos relationship or the space available. According to it, class 1, class 2, class 3 we did. So, class 1 where this second molar and the Ramos of the manual. This adequate space is available for the eruption of the tooth. So, it is 1. When less of space is there, class 2, 2, and class 3, when it is completely into the ramus of the mandible, it is 3. So remember, when the scoring is between 7 to 10, it is very difficult. 5 to 7, moderately difficult. And 3 to 4, minimally difficult. So, here what will be the answer? It is this triangular. So, it will be 4 plus, in the question, it was class 2 and level 2. For level 2, it will be 2, and class 2, it will be 2. So, it is 8. So, it comes in the very difficult category. Very difficult. Let's come to the next question. Impacted canines most likely are ankylosed. They may damage the roots of the other teeth, are good in function, or they will not erupt until the root formation is complete. So answer here is they cause root resorption of the adjacent teeth. It is same for maxillary or mandibular canine. There will be root resorption of mostly the lateral incisor by the impacted canine. Why? Due to the pressure from the impacted canine which is trying to erupt. That is why it is crucial to sometimes remove the impacted canines. Next question. During the extraction, it is seen that the tuberosity is fractured but remains attached to the mucoperiosteum with intact blood supply. Then the treatment should be to reposition. Reposition the fragments and stabilize with sutures. Next question. The elevator can be used to advantage when multiple adjacent teeth are to be extracted. Here, interdental bone is used as a Not used as a fulcrum, but the adjacent tooth is used as fulcrum. Next question. Osteotomes differ from the chisels in that they are sharp, non-beveled or bibeveled. So they are bibeveled. Osteotomes are similar to the chisels, but the edge is different. It is bibeveled. It splits the bone rather than cut or chip the bone as with the chisel.